Okay, so now we're gonna do pelvis and hip on our same patient who's still on the table. We're gonna get her back in the middle here. Good. How you have y'all? Cattywampus. Okay, she's still not pregnant. We had her history. And on pelvis, we're gonna go with, our IR is gonna be crosswise or landscape, because you have to get the entire pelvis on here. Both wings, both trochanters, everything. So we're still in detent. We're at 40 inches to the bucky. We're gonna move this and align the two. And we're gonna change this to be 17 inches by 14 inches crosswise. Okay, now on pelvis, we have to get the femoral necks parallel. So what we're gonna do is come down here. I'm gonna make sure she's laying straight, so I'm gonna do that for a second. I'm gonna check both aces, make sure they're equidistant from the tabletop, which she seems to be laying pretty flat. And then what we're gonna do is bring her feet out and point her toes in. It's gotta be a 15 to 20 degree rotation to get the femoral necks to be parallel, so there's no foreshortening, and this will lessen the visibility of the lesser trochanters, because ideally we do not want to see them in here. Central ray, you want to make sure that you have iliac crest included, but central ray is 2 inches below ACES, which is right here. So I'm going to put the top of my finger at the bottom of her ACES. 2 inches is 3 fingers for me, and midline. All right, so midline, ACES, 2 inches below ACES at midline. So this line runs 2 inches below. I make sure I still have her crest on there. Again, light field is deceiving because somebody's in the way. So when you look at where the IR actually is, I'm actually getting from up here to down here. Okay, and crest is right here. So I've got both iliac crests in there. I've got the whole top of the crest, and then with her feet internally rotated, I should lessen the appearance of the lesser trochanters. I'm gonna go just like that. And then ideally they like us to use left marker. So I am going to put left marker on the left side up near the top. Ideally it won't get in there. I'd feel more comfortable with it up. You could put it down as long as it doesn't end up in, if the right was injured, I'd probably do left. That's left marker. If right was the one injured, I'd mark left. If the left was the one injured, I'd probably mark right, just so that I didn't obscure any anatomy on there. Okay, so we'll go ahead and mark left on this one. Feet are pigeon-toed like they're supposed to be. What I'm gonna have you do is just take in a breath and blow it out, and you'll hold it out for me, okay? Okay. We're set at 80 kVp at 12.5 mass. Take in a breath, blow it out, hold it out. Be good, breathe, you can relax your leg. So we said right one was injured. So what we'll do now, we did AP pelvis. Now we're gonna do an AP of just the hip. So we're gonna collimate to 10 by 12. And move you over. And this is just like an AP proximal femur. So we're gonna find ACES, and it's 1 to 2 inches medial and 3 to 4 inches down. So we're gonna go about 1 inch medial. So ACES, that's about 1 inch, and then 3 to 4 down. So that's 2, that'll be 4. I'm gonna come to about 3, which would be right here. So 1 to 2 medial from ACES, 3 to 4 down. And remember, our cheat is the crease. So if my finger is right in the middle of her crease, straighten your leg. I'm pretty spot on with where I want to be. And on this one, we're just going to internally rotate just the one leg, 15 to 20. Good, just like that. Work around. This is right. Sorry. All right. Just like that for me. Just stop breathing. Same. 80 at 12.5 feet. You can relax. And then we would do the modified cleaves or a unilateral frog. We would bend your knee and let it come out to the side. Good. Find ACES again. Still 1 to 2 medial. And 3 to 4 down. So 2, that's 4. All right. And creases right here. Right. Just like that. And this one, if you want it to look prettier, you can leave it like that, or you could turn it and have it run with the length of the long axis of the femur. I'll just leave it like this for this one, just because we can. Okay, just like that. Take in a breath. Hold it. Beep. Good. So most protocol, you can relax your mind. Most protocol out there now for a hip is an AP pelvis, an AP of the unilateral injured hip, and a modified cleaves or a unilateral frog leg of the affected hip. All right, so we'll let her get dressed, check those, and make sure everything came out.